With up to 7 million South African girls lacking access to sanitary products, suffering from what's known as period poverty, and countless young women feeling like they have no sexual and reproductive health and rights services in their communities. This led to the launch of a new app. FemConnect digital platform aims to make menstrual hygiene, sexual and reproductive wellness and family planning as easy as ordering food online. Now, this will provide, a holistic digital solution that enables young women to seek free, real-time advice on channels such as WhatsApp and social media, a first of its kind in South Africa. To share more on how the app works, we're now joined by Asonele Kuto, the founder and CEO of FemConnect. Asonele, a very good morning. Thank you so much for joining us. Welcome.
Good morning. Thank you so much for having me.
Now, why did you feel there was a need for this app? I mean, what sparked the idea?
So coming from a community where I was exposed to issues such as girls not having sanitary pads and also personal experiences around myself, friends, family, and also looking at the state of how we used to access, for example, family planning services coming from a township. It's so difficult to get accessibility quickly and conveniently, and also the things that you want for your own body. So the whole thinking was around creating easier access for girls and women to be able to get access to the services that they wouldn't usually have around them, which are critical services and also a basic human right. So what we've created is that we don't want people to struggle to get sanitary pads. Meanwhile, we all have phones and we're now starting to all have access to the internet. So we're trying to find easier ways in connecting girls that are in need with people that can give back to them, and also creating an easier way of finding access to services that can help you take care of your sexual and reproductive health as a woman or a young girl.
So what sort of technology is being used then to create safe and discreet access to, sexual and reproductive health resources?
So what we currently have is we've got 2 channels that we use, and it's a online platform, and we've got the mobile app. And the channels perform 3 key things, which is 1, providing access to period poverty support. In that way, girls can then go up the app and say, "Hi, I'm Asonele, I'm from Khayelitsha. I need sanitary pads, but I don't have anybody to talk to." We would then intervene and say, okay, there's a girl in Khayelitsha that needs sanitary pads. We reach out to our beneficiary organization, and we also do some fundraising through our platform where we're saying to people, please donate to X amount of girls in Khayelitsha, Langa, and these areas. And then we use our technology to source those donations and distribute it to the beneficiary organization. The secondary component is if you want any kind of information and support and education around your understanding your reproductive health or your sexual and reproductive health, you would then go onto our platform and speak to somebody that would be able to advise you. And you can ask to have a phone call, a video call, a WhatsApp call, or maybe a one-on-one email session where you ask your questions and an expert will give you the advice that you need. The third component, which we would then introduce at a later stage, is the online family planning, where you would go online and do your family planning, and then we deliver your contraceptives or your sanitary pads or any other thing that has to do with feminine hygiene to your own doorsteps, so that you don't have to go around. And we continuously saying that we want to make access to services around SRHR as easy as ordering food online.
So which residential pharmacists or counselors are you working with?
So we've got in-house support expert. We call them our expert resident pharmacists or resident expert, and they work directly with us, and they also advised on the process when we started building to say, okay, these are the critical questions that one would get asked if you go to see a doctor or maybe anybody that deals with this kind of issue. So they gave us guidance. What are the critical questions? What are the areas that you should look at? What should be the red flags to say to somebody, no, you cannot continue to work on the mobile app. You now need to see a doctor. So the medical expertise and the thinking and the advice and shaping around that area was coming from them. So they've been critical in also the building of the app and also the website to up until where we are right now.
So how do users then donate sanitary pads? I mean, is there a system of, collecting these pads? Are there any collection points for these pads, or I simply donate directly to the needy user?
So how it happens is that you would go onto our mobile app or onto our website, and you would go to where it says end period poverty. Now, you've got two options in that area. You can either donate online through our platform, and then you use a reference of the organization that you're donating to. To give you an example, we've got two beneficiary organizations that we're currently working with. One is Womandla, which does schools in Langa. One is Lend a Hand Africa, and they're based in Nigeria. So we've got two campaigns that we're running, and you can go on our platform, website or app, and say, I want to donate. You donate monetary donations, and you put your reference of your organization. We then take the donations that came in, for example, for Womandla, and say, in the month of August, this is the donation amount that you got. We arrange all the sanitary pads and everything. We liaise with the beneficiary organization, and then we do a handover to them. And they then distribute it to the school or to the community that they work with. And that's how the system works. The second option is that we do have one or two drop-off boxes that we have at retail stores, where a person can actually physically drop off pads, tampons, bins. And we're hoping to have as many of these drop-off bins in many other retail stores, so that people who cannot donate online can physically drop off when they're doing their shopping or anything like that.
And how can users then apply to mentor a young girl?
It's all on the website as well. What you do is also you choose the option to say, I want to mentor or adopt a young girl for a year. You give us your details. We then liaise with you and pair you up with maybe a girl that's close to your area, depending on your time and availability. Do you want to virtually mentor a girl? Do you want to just give donations in terms of sanitary pads? You choose the way of engagement that you want, and then we pay you with a girl that said, I am looking for a mentor, or I'm looking for assistance.
Right. So where is this app available?
It's currently on Google Play Store at the moment, and then we are also live on our website for those who don't want to download the app. The app is completely free to use. There's no subscription fees, and it's available for anybody. And also specifically, we urge young girls who need assistance with sanitary pads but do not have anybody to talk to, or do not have any program that they're linked to in terms of support, to go onto our website or to our app and go and request, so that we know what are the numbers that we're dealing with out there and how many people are in need out there, because that data and those stats that is something that it's critical, and we need to know in terms of pinpointing and understanding how big of a need this is in South Africa currently.
This is what South Africa needs, especially South African women and girls. So if somebody wants to work with you, how do they connect with you?
They can just connect with us through email. You can email me. My email is Asonele @FemConnect. It's FemICONNECT.com. Or you can just go onto our website and then just send a note or a contact us form, and then we'll get in touch. And we are definitely looking for collaborations, because we want to work with as many organizations that are already doing the work in communities, and we do not want to duplicate. So collaboration is very key in terms of us making sure that we reach as many girls as possible across the whole of 9 provinces of South Africa. So definitely, we are definitely looking for people to speak to, collaborate, and work together with.
Okay. Asonele, lovely chatting to you. Thank you so much for joining us.
Thank you.
Well, we just spoke to Asonele Kuto, the founder and the CEO of FemConnect, a new app on menstrual hygiene, SRHR wellness and family planning.